from our health facilities, all having registered full recovery since the onset of this pandemic, and there are now 481 cases that are currently undergoing treatment. I want to thank, once again, the dedicated and skilled Kenyans who are working around the clock to keep our infections relatively low so far. And I also want to thank the tens of millions of Kenyans who are adhering to the health, hygiene, and social distancing measures that have been put in place by our health officials. Fellow Kenyans, if we had not taken tough steps, the Public Health Emergency Operations Center calculates that there would be many thousands of infections across the country, and indeed, many more fatalities. It is, however, clear that we have still to deliver a fatal blow to this enemy that has afflicted our country and the world at large. In the last week, we have unfortunately witnessed an increased number of imported cases among individuals crossing into the country through our borders. And these new areas have become a matter of grave concern to us. Among the positive cases that have been registered in the country this last week, a total of 43 cases have recently crossed the border from neighboring Somalia and Tanzania. As of yesterday, the cases that have crossed the border were distributed as follows. Wajir had 14 cross-border cases. Izebania had 10 cross-border cases. Namanga had 16 cross-border cases. Lunga Lunga had 2, and Loitoktok 1. These 43 cases represent almost a quarter of the 166 confirmed infections during this last week. Further to this, 78 truck drivers who are foreign nationals tested positive for COVID-19. They were denied entry into our territory at different border crossings. If we had not undertaken that intervention, the imported cases through our borders would today have accounted for more than 50% of this week's infections. Within our borders, infections have now spread to 22 of our 47 counties. These numbers and the spread of infection clearly indicate that if no action is taken, all the gains already achieved in combating this pandemic will undoubtedly be lost.